Now, there are many questions and concerns that come to mind whenever you start discussing health insurance. Atop that list, of course, is cost, whether it's the premiums or the out-of-pocket expenses. Then there is the challenge of finding the right policy and the company to fit your needs. Well, today, you're going to get to know a company that does things a little differently, and that's a good thing. Joining me is Jesse Thomas, the CEO of InHealth Mutual. Welcome, Jesse.
Thank you. It's a pleasure to be with you, Crystal.
It's a pleasure to have you here. We want to know all about InHealth Mutual.
All right. Well, InHealth Mutual is a health insurance co-op, and we were chartered to inject access, innovation, and competition within the marketplace.
Now, some people have heard the term co-op. We've heard it used in other ways, but not as it pertains to health insurance. So how does a health insurance co-op work?
Okay. Well, a co-op, really, that's an acronym for Consumer Operated and Oriented Plan. And importantly, it is built by members for members. And it is even governed by members. In fact, starting in January, of our 15-member board, 8 of those board members will be policyholders. So it really is governed by the people, and it's run by the people, and it's designed for the people. Have the people in mind.
That's a really different way of doing things, where you actually have a say in the health insurance and how it works.
Absolutely.
And that's really what makes it so different than all the others, right?
Absolutely right. In fact, we did listening tours around the state. We put together a statewide steering committee, and we really wanted to avoid the notion that all the feedback from stakeholders all around the state, individuals and families, small businesses, community-based agencies, the faith community, and others. And through those listening tours, we learned some interesting things about what the people wanted in their health insurance plan. And so we took some of that counsel and fashioned our products and designed it around that feedback.
So I'm guessing your clients have a higher satisfaction rate versus clients of other companies.
Well, I certainly know that our members are satisfied, and we will do an annual survey just to see how satisfied they are. And when we learn things that are concerning for them, we work on those things to kind of get it to align with what they want out of their health plan.
So let's talk about the importance of health insurance. You say that health insurance is so important not only to stay healthy, but to help maintain your budget.
That's exactly right. Nobody plans to be sick or to have an accident, and it's hard to predict when that might happen. And so rather than being faced with a catastrophic condition, something that's unbudgetable when it happens, and then you end up trying to figure out, scrambling how to pay for it, some health conditions can cost tens of thousands of dollars.
Sure.
And so if you haven't offset that cost by paying a portion of it in advance through premium, then you are likely facing something that can be pretty catastrophic. And oftentimes, the absence of health insurance is the single biggest bankruptcy cause in the country. So we want to make sure that they're able to budget for those things.
Can you tell us specifically what types of innovations InHealth has done to help your clients maintain their budget and their health?
Oh, absolutely. I talked about access, innovation, and competition. Well, we got feedback from around the state that it was important to our members to have things like acupuncture. Now, there's 10 essential health benefits that each carrier on the marketplace or the exchange have to provide in order to be ACA, or Accountable Care Act, compliant. And so with that, it was important for us to be able to learn what they wanted, and they told us that they wanted to have acupuncture. Now, that's not a requirement, but we offer it and we provide it. Something else that we learned is that many of the individuals were buying insurance because they were mandated to do so, but the products are fashioned around the medallions. So you have platinum, gold, silver, and bronze.
I've heard of that.
And if you're at the platinum end, you have the highest premium but the lowest out of pocket. And as you come down those medallions to bronze, for example, the premium is going to be lowest, but it's going to be the most out of pocket. And that turned out because they have $1,000 out of pocket before they start enjoying their insurance benefits. And so that was a barrier. How do we address that? Mm-hmm. We provide what we call 2+2. Visits for behavioral health issues or for physical health issues. So we wanted to take that barrier away, and that's an innovation. And another innovation would be in and around it's important to have a member get the right care at the right place at the right time. And to do that, it would be good to have visibility into their health history. So we ask them to complete voluntarily a checklist that gives us their health history. Not to do any underwriting, but to figure out how to assign a nurse to be the case manager, and then to write out a care plan and to make sure they get the right care at the right place at the right time. And when they do that, they are much more satisfied, and since it's voluntary, we will give them an incentive to do that. We will reduce their deductible, an individual, by $250.
Wow.
And a family, $500.
Jesse, it's all great information, and I know that our viewers will be interested in more information, and where you can go for more information is on our screen right now. Jesse, thank you so much.
Thank you.